Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On our episode today, we are hearing from Victoria Vaughan. She's a military spouse and a mom to a beautiful baby boy. She lives in Fayetteville, North Carolina, and works as a small animal veterinarian. She struggled with postpartum anxiety and depression and wants to be an advocate for other women struggling postpartum who may be hesitant to consider antidepressant medications. And as you who've been listening to the podcast know, this is a hot topic. People have a lot of misconceptions about medication, have a lot of fears and concerns about taking a medication, specifically for anxiety, depression, in ways that they might not or don't necessarily have for other medical conditions. I'm very grateful that Victoria is coming on to not only share her story, but to continue to help us shed the stigma and misconceptions of medications in pregnancy and postpartum. So let's meet Victoria. Welcome, Victoria. Thanks so much for being with us.
Thanks for having me on.
I am really glad you're going to be talking about your experience for multiple reasons. So let's just get into it and start wherever you'd like to start with your story.
Sure. I'll start with, I guess, my labor and birth. So, throughout pregnancy, I had a pretty easy pregnancy, I would say. I guess I was lucky in that way. So the kind of tough parts start when I was in labor. I kind of had this vision of what I wanted labor to be like. I wanted like a natural birth, no epidural. I wanted to like have a peaceful labor. I did a lot of hypnobirthing practicing beforehand, and it just did not go the way that I envisioned. And that's okay. But I was in labor for about 64 hours, so a pretty long time.
Very long.
And it was just really tough, like mentally and physically. I did end up getting an epidural, and I felt good about my decision, even though I told my husband beforehand, I was like, don't let me get an epidural. I had a doula. I was like, this is, one of my main things. I don't want an epidural. But I ended up feeling really good about my decision just because I was so exhausted, and just felt like I really needed it to relax. And it was great. So it definitely was helpful for me. And so that was kind of toward the end of the 3 days. And I ended up having a normal vaginal birth, no C-section or anything, which was good. That was also one of my fears. But my baby did aspirate meconium. So as he came out, I'll kind of back up, when my water broke a couple of hours before my epidural, there was no meconium in it or anything. But when I was birthing him, they noticed it on him. So the NICU team had to come in really quickly and help him. So I didn't get that skin to skin. I didn't get to hold him. We didn't get to delay the cord cutting or anything. So I could see him and I could hear him trying to cry and everything, but they took him to NICU. He was there for 3 days. I got to see him right after I kind of recovered and everything, like after I gave birth and I recovered. So I got to see him maybe like an hour and a half later. And it was just really tough to see him, like with all the tubes coming out of him. And that was like the first time I was really getting to see him for longer than, 2 seconds.
Right.
So that was really hard. And I just cried, and I didn't really want to even try to hold him or anything because I just felt so upset about it. But yeah, he stayed for 3 days. He improved every day and was doing great by the end. So we got to take him home, which felt really exciting. Of course, it also felt a little overwhelming as first-time parents, taking your baby home. You're like, what do I do?
Yeah, right.
So it was pretty overwhelming at home. He was crying all the time. Like it just felt like he would always cry. If he wasn't sleeping, he would just be crying. And I do have a history of having just like mild anxiety. I'm a veterinarian, and so during vet school, I think my anxiety was kind of amplified. And I've always done like some talk therapy here and there to sort of help manage my anxiety.
Mm-hmm.
But I felt like it was just amplified, like when we got home with
Yeah.
this newborn,
Yeah, for
and him
sure.
crying all the time. I just didn't really know what to do.
Mm-hmm.
And he wasn't wanting to nurse well. So
Mm-hmm.
I reached out to a lactation consultant. She evaluated us and said he has a tongue tie, and that should help if you get it lasered. So we got that done, but I didn't really feel like it helped much. He would still cry all the time. He would nurse, but he would like he'd latch on, cry, come off, go back
Mm-hmm.
on, cry. So it just was like it was very defeating all the
Right.
time.
Right.
Um,
So can I ask a question about
absolutely.
like what it sounds like the crying was all
Hmm.
day,
Yeah, that's what it
just
felt like. Hmm.
mostly constant.
Yeah.
Outside of, you said, the sleeping.
Yeah, like he was just really colicky.
Mm-hmm.
Hmm.
Did that start like from the get-go? But
I
like as
think,
soon as he
yeah,
came out, kind of a thing?
I think it did. Yeah, I feel like it did.
Mhm.
Yeah,
In the if I can go back to
sure.
the NICU for a moment,
Hmm.
were you given after that first bit of time where
Hmm.
when you were first able to see him,
Yeah.
was somebody else with him, or
Yeah, my
your
husband was.
he went to the NICU with him?
Hmm. With him. Yeah.
Okay, so then were you, after labor, were you kind of in the room by yourself?
Yeah, I had a doula, so she was with me. So
Okay, great.
I felt
Oh,
supported.
yeah, yeah,
Yeah,
that's like one really good reason to have a doula. Um,
absolutely. Hmm.
I mean, there's so many good reasons,
Yeah.
but for sure that's good. So you don't have to be alone if something like
Yeah,
that happens.
exactly.
Okay, so you oh, right. So back to the NICU. Your husband had
Hmm.
been there
Hmm.
with him. By the time you
Yeah.
got to go see him, that feeling you described of kind of
Hmm.
like not wanting to hold him,
Hmm.
what can you, I guess, if you have anything more to describe, like what that felt like or why, because I
Hmm.
think it's an important thing to highlight, because other people have that experience too.
Sure.
What everybody thinks is that no
Uh-huh.
matter when you see your baby, you're
Hmm.
gonna be like over the moon and elated, and that is
Right.
just not true for
Hmm.
everybody. So,
Yeah.
anyways, that's kind of why I wanted to go back and see what that
Sure.
was like for you, and how you were able
Yeah.
to get to a point where you did want to hold him.
Sure. I think it's just because I don't know, I felt so bad for him just with all of like the tubes coming out of him and everything, his IVs in. I
Mm-hmm.
just felt like he was really helpless, and I felt like I couldn't like properly be there for him. Like I could be there and like hold his hand, or
Mm-hmm.
whatever, but I couldn't like hold him and like nurse him or like have the experience that I envisioned for him.
Mm-hmm.
And so I felt helpless in that way.
Yeah, yeah,
Um,
yeah,
and it just made me really upset.
yeah, for sure.
Yeah.
Did it take a while before you were able to kind of have more contact with him, or feel like you could do that?
No, we went back to our room and slept for, I don't know, maybe like 5 hours. I had pumped some colostrum for him, so they were feeding him that. But after I woke up and kind of took a breather and spoke with my doula and my husband, I felt a little bit better. And then we went and saw him, and he was doing a little bit better when we went and saw
Okay.
him for the second time. And then they were like, "Oh, do you want to hold him?" And I was like,
Mm.
"Of course." And so
Mm-hmm.
that felt a lot better than the first time that I got to see him.
Right. Okay. So right, you had been in labor for
Hmm.
days,
So long. Yeah.
for days. So you were
Hmm.
exhausted, and I
Hmm.
mean that, I think, lack of sleep is
Yeah.
a really big component for a lot of
Hmm.
people too. It's just like
Sure.
you don't have anything in you.
Nothing. Yeah.
Right. So sleep is magic. That helped.
Hmm. Hmm.
And then, okay. All right.
Yeah.
Yeah. Thank
Yeah.
you for kind of going back to that.
Of
It seems like a
course.
really important part of your experience.
Yeah. Yeah. I would say it was. Um, But yeah, so he got his tongue tie revised, and it just didn't really help much. He still, um, he would nurse okay, but it was like it would take forever to, because he would like latch on, cry, come off, cry, go on. And it was like we were just struggling like that all the whole day, it felt like. So he was also really colicky. So he's really gassy and had a lot of trapped gas. Um, and then every night he had what my husband and I would call witching hour. So for like, I mean, it felt like probably 3 hours every night from like 8 to 11, I would say. He would just like cry, just cry and scream. And it was really, it was tough. I mean, I felt like he probably was like that. I mean, it felt like 3 months every night. So I would like go upstairs in our room where the comfy glider was, and I would just like sit with him in there and like nurse him and hold him. And he would just like cry on and off for 3 hours. And then eventually I could get him to sleep, and then I could go to sleep. But then he was up, every couple of hours nursing. So it's like I was just absolutely exhausted all the time. And he just was really colicky. If there were a couple nights where like he would scream so much that I was like, do I need to take him to the ER? Like, what is going on? What's wrong with him? I did take him to the doctor the next day one time after he was like screaming for hours one night. And they took a look at him and they were like, yeah, he looks great. This is normal. This is just a normal part of like a colicky newborn, basically. But I felt so isolated because a lot of my friends were having babies around the same time, and I would bring up what was happening with my baby, and they were like, oh, my baby's a little fussy, but that, sounds like a lot. So I just felt kind of isolated from everyone
It's a whole lot.
else. It is, yeah.
Yeah, that's really tough when there's no kind of direction. You
Hmm.
can start to feel sort of like desperate for solutions. Like,
Absolutely. Yep.
what was that part of your journey like,
Oh my
trying to
gosh.
figure it out?
Yeah, I mean, that was tough. So my personality is like, I have to research everything. I want to know everything. I like to have a plan and everything. And so I would like research all this stuff and all these Facebook groups and online. And at one point, I went down this rabbit hole of like, oh, he has reflux, like he has silent reflux. And I was telling my husband that, and he's like, no, I don't think he has that. And I was like, I really am convinced he has silent reflux. So I took him to the doctor, and they were like, well, we could try a medication. So I think we tried like omeprazole or something for like 2 weeks, and it did nothing. But I was convinced that he had it. And yeah, I would just latch on to all these things. I'd be like, oh, it's, a nursing aversion, or it's reflux, or it's so and so. But at the end of the day, looking back, like there was nothing specific that was causing his colic or him to just be so fussy. It's just how he was. But yeah, you're right. I mean, I was desperate for an answer. I was desperate to fix it because that's my type of personality. Like, I want an answer, I want to fix it. So I felt really helpless in that way. But I would say I was afraid to accept help from like my husband or my mom, my family, my friends who were like, oh, we'll watch him for a few hours while you go do whatever. And I would be like, no, no, it's okay, because I was worried that he would get so upset without me, and maybe they wouldn't know how to care for him the way that I thought he needed to be cared for.
You're
So
like
I really,
trapped.
yeah, that's exactly how I felt. And it got like, my feelings just turned into a lot of like resent toward my husband, because he's in the military, and he was doing a course at that time. So he would like still, get to go in and do his classes and stuff. And I was like, wow, he gets to like be around people, and he gets to be away from the baby. Not that I hated being with my baby, but like, it was just, you're right. Like, I just felt trapped. And I even like ordered earplugs from Amazon because I was so sensitive to his crying.
Yeah.
Which I mean, that was kind of a red flag for me. I should have gathered that like maybe I have some depression symptoms. But it's like I wouldn't say his crying triggered me, but I was just so sensitive to him crying that like I
Right.
just couldn't take it all the time.
Yeah.
And I just was extremely like overstimulated, overwhelmed, literally 24/7. There wasn't a moment where I wasn't overwhelmed.
Right.
Even in the shower, like my husband would hold him for an hour while I took a shower. I would just like stricken with anxiety in the shower, thinking about like, okay, how, like, what can we do tonight to help him not cry? Or, how can I better care for him? So it was just like these really
Yeah.
intense
It's like all
feelings.
consuming,
Yeah,
just all the time in your
it
thoughts.
was.
And
It was, yeah. And it was translating over to like, I wasn't really caring for myself properly. So I felt like I never had time to eat and I would just put it on the back burner.
right.
Because I'd be like, well, I have to take care of Roman. Like I don't have time to eat right now. Like I have to be a mom. So I ended up, I got on the scale a few months postpartum and I had lost like, I was like 15 pounds under my prenatal, under my weight before I got pregnant,
Mm.
which was a big red flag to me because I
Yeah.
haven't weighed that little since like maybe college.
Right.
So I was like, this is not good. I did end up reaching out to um a postpartum therapist,
Hmm.
because I felt like, my intense anxiety needed some attention. But
Did you,
I,
at that, just
mm,
curious, did you
yeah,
know that that was a thing? That there were therapists specifically for um, pregnancy and postpartum, or
I didn't.
did it
I
like
actually
show up
had
in
no
your search?
idea.
Okay.
No, I had no idea. It was my lactation consultant that,
Mm.
in the same kind of firm where her consulting business was, they had postpartum therapists. So she's
Mm.
the one that suggested that.
Mm. Mm-hmm.
And I was like, okay, that's a great idea. So I
Yeah.
did virtual appointments because again, I felt like, um, I just felt trapped. Like I felt like I couldn't even leave the house unless there was a
Yeah.
good reason. Like Roman has an appointment that I have
Mm-hmm.
to take him to.
Mm-hmm.
But I would get anxiety about that. I'd be like, well, he's going to cry on the way there. He's going to scream. Like, what am I going to do?
Mm-hmm.
So I didn't even want to leave the house. Like it was like looking back, it was really bad.
This
Um,
is like kind of still in that 3 month window. Okay.
exactly. It's
Mm-hmm.
still in that window. And so luckily this postpartum therapist was like, oh, I can talk to you virtually. And I was like, okay, great. So I
Mm-hmm.
think we had 3 sessions, but honestly, unfortunately, it wasn't helpful for me.
Mm-hmm.
She would kind of just talk about my anxiety and do like these worksheets, um, and just be like, okay, where do you think your anxiety is stemming from? Okay, these are 3 exercises we can do to help your anxiety. And like it just absolutely did nothing for me.
Mm.
And I think it was because I was really depressed. And I probably needed more than just talk therapy. I probably needed some medication at that time.
Mm.
But it also, looking back, it does make me a little bit sad that she never brought up like that I potentially could have postpartum depression or that maybe thinking about medication would be a good idea for me.
Mm.
I don't know if I was just putting on like a really good front with her or what, where she
Mm.
didn't feel like maybe I didn't need that or something. But I really wish she had maybe dove into that a little bit more so I could have gotten more help sooner.
Mm.
Um, but yeah, I would
Yeah.
say, after that, going back to me kind of being that person that has to have all the answers and know everything, I read a book. I didn't read a book. I listened to it on audiobook while I was rocking my crying baby.
Yeah.
But I listened to this book. It was called The Postnatal Depletion Cure.
Mm.
Um, and that is a book that made me realize I think I have postpartum depression.
Mm.
And so it was talking about postnatal depletion, which I didn't really know was a thing. It was saying that basically having postnatal depletion can increase your chances of postpartum depression. And postnatal depletion, the symptoms were things like being hypervigilant, um, brain fog, being frustrated, anxious, overwhelmed. So at first, when I was listening to the book, I thought, okay, I have postnatal depletion. Maybe I need to look into like my minerals, because I know you lose a certain percentage of your minerals when you're pregnant. So I was like, okay, maybe I'm low on like zinc or
Sorry, so the
sure.
premise of the book is that
Mm-hmm.
there's like a physiological
Right.
part that,
Mm-hmm.
and it's attending to that.
Exactly.
Okay. All right.
Yep. Yep. So at first, when I was listening to the book, I was like, oh, maybe I have postnatal depletion and I need to, do these exercises that they're telling me about, or I need to get my zinc checked or my copper, iron, whatever. And then further into the book, it kind of identified like postpartum depression versus postnatal depletion. And it sort of went through this checklist, and I was like, oh, check, check, check. And it was saying stuff like insomnia in the middle of the night, which was me to a T. Like I was barely getting any sleep because
Right.
my baby would wake up, I would nurse him, and then I would lay back down to go to sleep, and I could not sleep
Eyes
because
wide open. Yeah, yeah,
yeah,
just like wired
yeah,
and
like I
tired.
exactly, yeah, I couldn't get any sleep. And it was also going over,
Sorry, but you were
sure,
exhausted, right?
oh, absolutely
Like it
exhausted.
wasn't like you were awake and had energy.
Oh no, zero energy. Like
Uh-huh.
absolutely exhausted, needed to be sleeping,
Mm-hmm.
could not sleep.
Mm-hmm.
Um, and then it was saying it was going over this postpartum depression checklist. So it was like, crying a lot, anxiety all the time, feeling, sadness, no energy. And I was like, yep, check, check, check. Feeling hopeless, check. Weight loss or appetite changes, yep, check. So I was like, maybe I am depressed. um, and I would say I also had intense feelings of like loss of identity at that time.
Yeah.
Again, this is still in those first like 3 to 4 months
Yeah.
postpartum.
Mm.
But I just felt like I was literally existing to take care of my baby. And there was like nothing else at the time, like for me to be existing for.
Right.
I didn't feel like suicidal or anything, but I felt like I literally existed to like attend to him.
Right.
Um, and I
Right. Yeah,
felt
and you
super,
that was
yeah.
like that was accurate.
Mm-hmm.
I mean you that was
Yeah,
all that you were doing, all
that
that
was
you were
literally
thinking
it.
about,
Yeah.
kind of like
Mm-hmm.
hyper focused on.
Right.
Yeah.
Yeah. Yeah. I also felt really isolated, even though I had a lot of friends who had just had babies. My best friend had just had a baby 4 months prior. Um, and, but I still, like, even though I talked to them a lot, I felt so isolated because I just felt like I don't want to burden them with everything going on with me, because it seems like they're doing okay. Like they're actually going out, into public and stuff. And I just felt so much anxiety that I couldn't, like, I couldn't even like go outside and like talk to my neighbor down the street because I felt so much anxiety about taking the baby out of the house. Like it was really bad.
Mm-hmm.
But I felt like I didn't want to burden all my friends with like everything that was happening. So I would tell them like bits and pieces, but I never really told them like the full like scope of what was going on with me at that time.
Yeah.
So I felt really isolated, kind of by my own doing.
Mm.
Um, but
But right, I
yes.
mean, by your own doing, yeah, but because of what you were going through, like this is, it's not
Right.
like you were like,
Yeah.
yeah, this feels great to be
Mm-hmm.
inside all the time. I
Mm-hmm.
actually hate
Mm-hmm.
going out.
Yeah.
I mean, you know, it,
Mm-hmm.
it, I think it's hard in those periods of time and in those moments because while yeah, you can say yes, it was your own doing, it was something that you were doing. It's not like an intentional thing. It
Right.
feels like
Yeah. Not at
that feels
all.
like your
Yeah.
only choice.
It was. Yeah. That's how it felt to me at that time.
Hmm.
Definitely. Um, and I even had like, because I felt so kind of trapped, as you said earlier, and just sort of like I wasn't existing for anything other than to take care of my baby. I literally had like, I downloaded one of those countdown apps on my phone and had a countdown of like okay, this is when he turns 4 months, so he'll be more interactive and maybe won't be crying all the time. This is when he turns 6 months, so maybe he'll cry less. This is 8 months, maybe he'll like be really interactive with me. And so I literally had a countdown of like every month because like I had nothing to look forward to.
Right.
And
Right.
I was crying all the time. Like I just was really in a rut. And as I
I
said, I
think
read, go ahead.
I just want to note that how I think I am always
Hmm.
so amazed by people who are in intense suffering,
Hmm.
um, and they, like you're describing, finding something to hold on to.
Hmm. Yeah.
Yeah, I don't know if anybody suggested that to you, but it sounds like it came from inside, that like you
Hmm.
just needed
I
something.
did.
And like
Absolutely.
that, even though it feels horrible and
Hmm.
hopeless and helpless, there's still like that thing that that people try to hold on
Hmm.
to something. And I
Yeah.
just think it's, I don't know, the human condition is a trip, but like that is
Hmm.
an amazing part of what I see in this postpartum period of really trying to, like, what can I hold on to as a lifeline?
Hmm.
Um,
Absolutely.
and
Hmm.
so that was at least one of them that you
For
found.
sure. Yep. That was like really the only thing.
Mm-hmm.
And I will also note I never had a postpartum checkup at my hospital because they didn't have any appointments available until like middle of December. So I would have been like 12 weeks postpartum.
What?
Yeah, so I
Wow.
birthed at a military hospital and they're extremely busy. And for
Yeah.
some reason, they didn't schedule me a postpartum checkup before I left the hospital. I feel like a lot
Mm.
of places might do that, but they didn't. And so when I called to schedule it, I also will note when I was birthing, I didn't tear at all, which was great.
Mm-hmm.
Um, but yeah, when I called to schedule, they were like, oh, we're booking, out until December. And I was like, oh, but that's more than 6 weeks postpartum. I think I need to be seen before that.
Yeah.
And they were like, we have nothing. And so they
Wow.
booked me in like December and I didn't end up going to it. I was like 12 weeks postpartum, but I didn't feel like they could really help me because to me, it felt like they didn't even care enough to like schedule me 6 weeks postpartum.
Mm.
So I just didn't even go to it. And I just also had anxiety about like leaving the house and I just felt like they weren't going to help me or anything. So I didn't go.
Right. Yeah, uh, that makes sense. I mean, you felt, did you, I was gonna insert what I think you felt, but
Mm-hmm.
like,
Yeah.
how did you feel? Like, was it like a letdown or
Mm-hmm. I
a
would say
mistrust or,
Yeah, I would say it was a letdown that they did to me. I mean, I get like they're a military hospital, they're extremely busy, probably taking more patients than they should.
like
But
they're understaffed or,
yeah, I think they're probably also understaffed, I would assume. I don't know that.
mm,
Um, but yeah, I just felt like, okay, if they can't even work in like a 6 week postpartum mom into like the correct, time frame, then they're probably, I bet they just didn't, what are they going to do at my appointment? Like they're probably going to just look at me and be like, okay, looks, you look fine. You didn't tear. So there's really nothing to check. So you're good. So I just felt like, and again, like I should have gone, I know they do that screening for postpartum depression, like the sheet you fill out.
mhm.
So maybe they could have caught it then. But luckily, a couple weeks after that, so now it's end of December, beginning of January.
Mm,
So my husband, as I said, he's in the military. He was finishing up some training that he had to do. So he was about to leave for 3 weeks in January,
mm,
and I still was in, intense anxiety, like not doing great. So my mom was going to come in and help me for like a week and a half before she started class back. She's a professor at a college.
mm.
So she was going to come in and help me. But before my husband left, I was like, I have to like get some sort of help. Like I need help. Like I realized like I really need help.
Did
I don't,
anybody know that you were struggling?
my mom did, my husband did. Um, some of my friends did. I don't know that I told them the full scope I mean, my husband knew the full scope and my mom did.
Mm-hmm.
But I would say maybe that's it
Mm-hmm.
then. And my mom, I don't think she struggled with postpartum depression. So I don't know that she knew that, like, hey, you might need to think about, seeing someone and maybe talking about medication or something.
Mm-hmm.
And my husband, he was helpful and everything, and he meant well, but he is not a woman. So I don't think he really understood the scope of like
Mm-hmm.
everything. He just knew I was struggling a lot.
Mm-hmm.
So because we have military insurance, it is kind of hard to get into like your primary care provider on base sometimes. You have to reach out to you have to go through a lot to get in to see them. So I felt like I didn't know if I could get in right away to see someone before he left. And I felt like I really needed, I reached a point where I was like, I think I need like medication, like postpartum or like anti-anxiety medication. And I had never taken anti-anxiety medication and nothing like that, even though I did have anxiety before this. I'd never been on medication. So I did reach a point where I was like, I think I need medication. So I was looking on Google, and all of these websites were coming up where like you can connect with a doctor online.
Mm-hmm.
Um, and so I ended up like making an appointment that night to connect with a doctor online.
Mm-hmm.
And it was a woman. She was really nice. And I talked about what was happening. And she was like, I think you need a medication. Like, it seems like you have postpartum depression. And I was like, okay, great. So she wrote me a prescription, or I think she called it in to my pharmacy, and I picked it up the next day.
Wow.
And I started it the next day, and it took about 2 weeks for me to start feeling better, but I did start feeling better within those 2 weeks. And then I would say it took a few months to really like feel happy again and feel like a ton better.
Yeah.
But eventually I did, and I feel so much better now. But it did take a little bit, and it obviously took a lot of time for me to come to terms with the fact that like maybe I need more than just talk therapy, or like I truly need help.
Yeah.
And yeah, so I would say that's kind of what got me to get on medication.
Right. So this is, you said about 4 months or three,
Yeah, it
four
was
months.
September, so 3, yeah,
Mm-hmm.
a little over 3 months postpartum.
Mm-hmm. Yeah. Um, was any part of your experience like, I guess, prior to taking medication, I guess, stigma about medication or stigma about
Mm-hmm.
depression or anxiety at all?
100%. Yeah. I would say there was definitely a stigma around getting on medication. I, again, like I had a lot of friends that had babies around the same time. I had friends that, um, had kids that were a little bit older. As I said, my best friend had just had a baby. It was actually her fourth baby. So she was taking care of that baby. She had 3 kids, and she just seemed like so happy, and she was doing it all. And so I just thought I should be able to take care of one child, like she's taking care of 4. And I didn't really know, I don't think I knew anyone who was on anti-anxiety medications, or like who had postpartum depression who had gotten on medication for it. Maybe one person, but most people I knew weren't on it. So I just felt like, yeah, I know I had a really fussy baby, but maybe these intense feelings of anxiety and other really intense feelings, maybe they would just pass over time. But I also knew that I had something more than just like baby blues, because baby blues are only a couple weeks postpartum. And
Right.
at first I thought that's what was going on. I was like, oh, I have the baby blues. But I mean, this obviously lasted for months. So I knew something more was going on, but definitely I felt like there's kind of a stigma around starting medications
Yeah.
for postpartum depression. And again, I didn't know anyone else on them. So I felt like maybe I didn't need to be on them. Maybe I could get by without them, but I realized I couldn't. Um, And then after getting on them, I kind of shared what was happening with people close to me. And actually, my stepsister reached out to me like a month after, and she's like, "Thank you so much for sharing your story. Like, I just got on an anti-anxiety medication, and it's helping me." So I was like, "Great! I'm glad I could, my story can help people." But you're right. I mean, to me, there was like a stigma around starting medications for that, because to me, it was like, if you can't find other ways to help yourself, like talk therapy, meditation, stuff, functional medicine, stuff like that, like, the medication is just a band-aid, but it isn't. Like, it truly is
Right.
helpful.
I hear that too, that a lot, and unfortunately too much, that, oh, if I take a medication, it's just
Mm-hmm.
gonna, like, I'm not really dealing with what's going
Right.
on.
That's what I
And
hear a lot. Yeah.
it sucks that that is like a prevalent narrative,
Right.
because
Yeah.
it's actually quite the opposite. Like sometimes the um, the anxiety or depression or symptoms you're experiencing are so intense that you can't deal with the, like,
Right.
whatever the underlying thing. Like
Mm-hmm.
going back
Yeah.
to like when you got those like anxiety management
Mm-hmm.
tools,
Right.
I find, especially with anxiety, if it's at
Mm-hmm.
that level,
Mm-hmm.
the tools are like, don't touch it,
Not at all.
because
Yeah.
you can't even focus enough to do the thing. Like,
Exactly. Yeah.
so once you're like, the intensity comes down a little
Mm-hmm.
bit, then you might be able to do whatever it is,
Right.
not necessarily
Sure.
like those particular tools, but whatever it is that can deepen or enhance your healing in whatever way
Mm-hmm.
you need,
Yeah.
which includes getting sleep.
Yeah, exactly. Which I started getting more of, and it was
Right.
great.
Right. So the medication helped
Mm-hmm.
manage the anxiety enough that you could
Mm-hmm.
sleep, so that you could
Yes.
sleep. Yeah.
Yeah. So I actually, when my baby would wake up during the night, I would be able to help him and then go back to sleep right after and not lay there awake for hours. So
That's brutal.
yeah,
I mean,
yeah,
brutal when you don't get the
it,
sleep.
it, it
It's
is absolutely. Yeah.
right.
Yeah. So it was really helpful. And I also was eventually able to go back to work, which felt really good.
Hmm.
Finally. I mean, I actually, before I gave birth, I quit my job at my vet clinic because I wanted to just stay at home for, I don't know, like 6 months or something. And I mean, I really wanted to go back to work, but when I had the intense anxiety and depression, I just felt like there's absolutely no way I'm going to be able to go back to work. So luckily, I was able to be out of work for 4 months or so, 5 months, and then eventually, I guess he was 6 months old. I was able to go back to work, but I felt good and happy and like really happy to be back at work.
Hmm.
Whereas, like, if I wasn't on the medication, I don't even think I would have been able to be at work. Like, I don't think I would have been
Hmm.
okay.
Hmm.
So it really helped me in more ways than one. Like, it truly changed my life, and really helped me. Um, and I also, like, again, I told you that I like to research things and I like to know
Hmm.
everything. So I did just want to say that I realized that I was me being like a white female, I realized that I was really privileged in that I was easily able to find like an online doctor, make an appointment that day, just pay out of pocket for my appointment. And the doctor didn't like question how I was feeling. She trusted that I was feeling this way, and she immediately got me the medication. Whereas I know that, like, sometimes for moms of other races other than, Caucasian, they have like the lack of kind of services available. Um, and people don't always believe that they're feeling a certain way. And so I know that they're less likely to receive like a proper diagnosis of postpartum depression and get the help they need. So I do want to just say that, like, I was privileged in that I was able to get the help I need, but some people aren't. And, it's not always fair. So,
Right. Absolutely. Yeah. Thank you for bringing in that point. You're very right. It is quite unfortunate that like women of color have
mhm.
often are discounted
Yeah.
their feelings. So I
Yeah.
mean, it's one of the reasons why people getting training in perinatal mental health, but also like
Hmm.
these underlying factors and of
Right.
racism and systemic oppression and those
Yeah,
issues are super real.
exactly.
And also another reason why it's necessary to have more providers of color
Hmm.
that
Yeah,
are trained. So yeah,
absolutely.
thank you for
Yeah,
bringing that in.
absolutely.
Yeah. So um, for your experience with
Hmm.
medication,
Yeah.
the first medication that was prescribed was the
Hmm.
one that worked.
Yeah.
Was
Yeah, it
wonderful. Okay.
did. Hmm. Yeah. Yeah, it worked. And yeah, it's been great. I'm still on it, and
Mhm,
I feel like I'll probably be on it for a long time just
mhm,
because of how helpful it is. I feel like I can function again. I feel happy. I can be a good mom. I can be a good veterinarian. Like, I'm able to be a good wife. So I
mhm.
feel like it's very helpful. Yeah.
I have I guess, kind of a side question, but not
Sure.
really. Like, I know that there's a higher also prevalence rate of
Mm-hmm.
postpartum depression and perinatal mental health
Mm-hmm.
conditions for people who are in the military, but also military spouses. And it
Mm-hmm.
doesn't. Sometimes that's because of like deployment, or they're
Right.
not like they
Yeah.
don't have the support. So it
Sure.
sounds like your husband was able to be there.
Yeah.
So it wasn't like a kind of a
Mm-hmm. Lack of
that
like
issue
him. Right. Right.
that
Yeah.
that issue.
Yeah.
Um,
Right. Yeah. So he was able to be there, which was great. Yeah.
was was there any additional pressure around you as a military spouse, dealing with something like postpartum depression? Did you feel any like of that, I guess, pressure or stigma, or that you, I don't know. I'm just curious if any of
Mm-hmm.
like that part of military culture around mental health impacted your
Mm-hmm.
experience, or was that like way outside
Sure.
of your experience?
Yeah. I don't think it impacted it too much. Um, yeah. I mean, I did kind of feel like, again, I was lucky. Like, my husband was able to be with us the whole time. He was
Mm-hmm.
doing his classes and stuff here, so we didn't have to be gone until I was like 3 months postpartum.
Mm-hmm.
But he was only gone for 3 weeks, which was
Mm-hmm.
fine. But there are some women who their husbands are gone for most of their pregnancy. They're
Mm-hmm.
deployed, or they're deployed right after they have the baby. And yeah, I mean, I guess for me, I was like, well, that's, I don't have to struggle with that.
Mm-hmm.
So that's great. But, maybe there's other women struggling more than me when their spouses have to be gone, for so long,
Mm-hmm. Sure.
or gone right after a baby is born or something.
Yeah, sure. That might be true for some folks.
Hmm.
Just overall, I know there's a different view on mental health within the military, so I um, wasn't sure if that like trickled into your experience or not, but thankfully it doesn't sound like it did.
Yeah, I don't think it did.
Right. And it's not like you needed another thing to make you feel
Right.
worse. You were
Exactly. Yeah.
feeling plenty bad.
Yeah, I was.
Yeah. So your experience, medication was a big part, a big help for you. And as you were saying before, as we were talking about before, there there is stigma. What do you hope that, or what would you like to say, or what do you hope that other people who are struggling with anxiety, what do you want them to know, and in particular about medication?
Sure, that's a good question. Um, I would say what I want you to know is, like, I see you and I hear you. All the women that are struggling with postpartum anxiety and possibly postpartum depression. I mean, it's extremely hard, but I would say getting on anti-anxiety medication truly has changed my life.
Mm.
And I don't think I would be where I am today without it. And I just want other women to know that you're not alone. You may feel isolated, and yeah, your friends probably aren't having the same experience as you, but you're really not alone. I, have gone through this, and there have been numerous other women who have. And I really just encourage other women who are struggling to be an advocate for themselves. If you feel like you aren't being listened to, you feel like your talk therapist, like it's not going the direction, or your talk therapy, if you feel like it's not going the direction you think it should be, if you feel like there's other therapies that might help you, then I encourage you to look into them. And if you feel like you need to be on medication, it's not a bad thing. Like it really, for me, it's been great. And yeah, I mean, I just encourage you to just be an advocate for yourself.
Yeah.
And then I also would say, I know I shared my the little tidbit about my stepsister getting on medication after I did, and she said it helped her a lot. And there are also one of my other friends who had a baby a little bit after me, maybe 4 months after me. She ended up sharing that she also got on the same anti-anxiety medication that I got on, not because she knew that I got on it, but she just randomly shared that she was on it. And I was like, oh, I'm on that same medication. And it made me feel better about it, because she is also a veterinarian with me. And she's someone that I really look up to. And to me, like on the outside, it just seems like she has it all, and she has this great family. She's so smart. Like she's just amazing. And so I guess to me, her telling me that she was struggling with the like similar feelings that I was, and that medication has also helped her, kind of made that stigma, feel less, and feel like it's okay. So, I mean, it really is okay to get on medications. Like you might truly need it. So,
right. Absolutely. Thank you for
yeah.
sharing that and sharing all of your experience. I know that it will help a lot of people. I mean, personally, like even people that I'm meeting with have kind of a similar trajectory with the
Mm-hmm.
colic, and how stressful it is, and how
Mm-hmm.
little you sleep, and how much you worry. And it's just so amazing to me how much strength it requires to keep
Mm-hmm.
going when you feel that bad.
Absolutely. Mm-hmm.
And it the irony of it is that you kind of can feel weak
Mm-hmm.
and feel less than, or feel like you're whatever,
Mm-hmm.
feeling bad about yourself. It's
Yeah.
super hard to see just how hard you're working
Yeah,
in those times. So
for sure.
thank you for sharing your story and coming on with us.
Absolutely. Thanks for having me.
Please get connected with Victoria on Instagram at victoriav.vet. If not you yourself, I'm sure you know somebody who has struggled with the decision to take medication for depression or anxiety or any other mental health condition. Because the stigma is so great and unwarranted, it really prevents people from getting the help that they need. So please share this episode so that people can understand what kind of barriers they're experiencing in relation to getting medication or getting the help that they need. And also hear that it's okay. It's okay to get help, and specifically through medication if that's what you and your doctor decide. On another note, for those of you who haven't yet tuned into my new podcast series called Behind the Sessions, please do. Every other Thursday, you will hear new episodes from me talking about what happens behind the sessions in therapy, what people are bringing into the therapy sessions, and how people are seeking help. It's one thing for sure to hear stories, and that is so important for us to understand that we are not alone. And I want to deepen that and help you understand how healing can happen. So that's what we'll be attending to on that series. And you don't need to do anything different. if you are already subscribed to the Mom and Mind podcast, then you'll get notification of those episodes when they drop. And I will also, of course, be posting about it on social media, on Instagram and Facebook, and as well as TikTok. All right. Thank you so much for being with us. Until next time.